Thanks, Stephen. Hello, everybody, and welcome to the first of our Coalition Conversation series this year, with a focus on social inclusion and mental health. So Coalition Conversations is an event we run every year in mental health reform, and this is our first event of 2024. And today we're going to be focusing on the very important topic of employment. So just before we begin, just to check, I think we have some trouble seeing the ISL interpreter. So we might just make sure that everybody can see okay first before I continue. I'll just give it a minute just to make sure everybody can see Catherine okay. So if you just make sure your view is correct on the Zoom. Okay. So just before we begin, I think it's important to take a moment to pause and reflect on the fact that with every conversation we have about mental health, it's important to be mindful of everyone's experiences, and that sometimes conversations around mental health can bring up difficult emotions. So we always like to remind everyone that there is support available, and please do reach out for support if you need it. We have a slide that we'll bring up there now in a moment that has a link to a few support organisations. And the slides will be circulated afterwards with the links there. If anybody does need support or if the conversation is difficult, please do feel free to step away. So as part of the event today, we're delighted to be launching our guide on mental health in the workplace, a guide to your rights. I have a copy of it here. You'll be able to see it now with my background. I'm going to have a slide up here now. I think we're just having trouble pulling up our slides, but we have two versions of this guide. So we have the full guide that has all the details within it. We also have an easy to read version of this guide, both of which will be available on the website at the end of today. And just to say that we'll have the slide deck when we have it folded up. We're also recording the first half of this event, and we will have it available on our website at the end of today as well. So we all know there's a wide variety of social roles that we can all hold that bring huge value to ourselves and to our communities. And for many, employment is an important avenue for social inclusion. The right to work and the right to just and favourable working conditions are human rights recognised in Article 6 and 7 of the International Covenant on Economic, Social and Cultural Rights. And as we know, Article 27 of the UN Convention on the Rights of Persons with Disabilities. So in a supportive workplace, work can also be a major determinant for good mental health and for recovery from mental health difficulties. It's thus inextricably linked with the human right to the highest sustainable standard of mental health. And of course, we know not all workplaces are well versed in how to support employees who may experience mental health difficulty. We also know that employees may not always know their rights if discrimination does occur in the workplace. So we were delighted to receive grant funding from the Irish Human Rights and Equality Commission to develop a guide on mental health in the workplace. So I suppose we just want to take a moment to thank the Commission and just to highlight that the views obviously in the publication are that of the authors, but we're very grateful to the team at IRIC for the grant funding and for their support throughout the grant process. This project would not have been possible without their support. I have to say we're incredibly fortunate to have the consultant Barbara Brennan working on this guide, and we're very lucky to be joined by Barbara here today to give you a flavour of the guide a bit later. The guide was also co-created by a steering committee of people with lived experience in mental health difficulties, and we're very grateful to them for sharing their expertise and their insight. They're a very passionate group who I think would have written a whole book if we'd let them, but they've done a remarkable job of providing insights in the guide, not only for employees, but also for employers who might want to learn how to be more supportive and more informed. So we have a really great agenda in store for you today. And to begin, we're going to be given an overview of the work of the HSE's Office for Mental Health Engagement and Recovery. And we here in Mental Health Reform have had the pleasure of collaborating on multiple occasions with mental health engagement and recovery, and I'm sure there'll be many more projects in the future. So it's my pleasure to introduce Una Toomey from Mental Health Engagement and Recovery to talk a little bit more about their work.
Great. Thanks, Susanna. My name is Una Toomey, and I'm the strategy lead for mental health engagement and recovery. So again, thanks to Mental Health Reform for extending an invite to our office to speak. And again, we very much so welcome the guide. This morning, I'm going to provide you with an overview of the work of our office and some of our key achievements in terms of our strategy, and also some of our planned actions over the next number of years. Stephen, I think you're going to move on the slides, so if you can just move, yeah, thanks. So I suppose for us, it's important to put a face to the names. So here is just a picture of our team. So the team of mental health engagement and recovery, along with some of our colleagues in the HSC. And this was taken at the launch of our strategic plan last year. And the name of our strategy is called Engaged in Recovery. And you can see there it was launched by Maria Walsh, an MEP. So on the next slide, you'll see that on the day we also celebrated 10 years of mental health engagement and recovery. The day was very well attended by a number of our colleagues across the HSC, and also by a number of people with lived experience. Again, that further endorses the importance of the work of our office. On the next slide, so I suppose for our office, mental health engagement and recovery, our vision is in line with Sharing the Vision, and Sharing the Vision is Ireland's national policy on mental health, and that's for a recovery-focused mental health service. Again, that actively involves service users, their family members and carers. It's also person-centred, and it values the lived experience perspective. So again, lived experience is the expertise and knowledge of people who are living with mental health difficulty. And again, that's unique to each person. For us, lived experience is that equal and essential partner in a recovery-focused mental health service. Also, in terms of our vision, is to have co-production at its core. So again, for us, co-production is working in that partnership way in terms of an equal relationship between people with lived experience and our mental health services. Also, our vision is that we prioritise and enable the holistic nature of individual recovery, and that we ensure that everyone who engages with mental health services feels valued, listened to, and understood. Might just go on to the next slide. So this is our strategy, which is called Engaged in Recovery, and our 5 core objectives are here to the right. Might just go into those in detail shortly, but I suppose just to mention them individually. The first one is to co-produce and enhance good practice model for meaningful engagement in our mental health services. The second one is to co-produce structures and systems that will ensure recovery education is embedded within our mental health services. The next is to support and enhance the role of peer and family support working. The fourth is to lead and support the implementation of our recommendations from Sharing the Vision. And finally is to embed sustainable model for IPS, which is the individualized placement support. The next slide shows the first of those strategies.
Sorry, Una, 1 second. Having a bit of trouble with the slides.
No worries.
1 second. If you can talk to it, Una, I'll get it up.
Sure. So our first objective is to co-produce and enhance good practice model for meaningful engagement in mental health services. So that work stream is led by my colleague Jacopo, and over the past year, we've delivered on a number of key objectives. The first piece, we, together with Minister Butler, launched an enhancing engagement framework this year. And I suppose that engagement framework ensures that we meaningfully engage with those with lived experience and our staff across mental health services. And there's a number of tools in that framework to support on how we can engage meaningfully across our mental health services. Also, in terms of our first objective, which is engagement, we are working to develop a CAMHS engagement process, and we've linked with one of the areas in how we can further develop the CAMHS engagement piece. Also this year, in terms of engagement, we had an engagement conference in June, which was really well attended. One of a key piece of our engagement objective is our lived experience panel. So again, our lived experience panel is a group of people with lived experience who come together to share the voice of people with lived experience. And in terms of the process, mental health engagement and recovery support that group. It's called the Volunteer Panel of Lived Experience, and each individual member is assigned to either a working group or a steering group to further embed lived experience across our different work streams. So I suppose in terms of engagement, we've made a lot of really good progress for strategic objective 1, and that's a real key area for ourselves in mental health engagement and recovery. The next strategic objective is just on the next slide. Sorry, just to speak to this slide also. So this is around our engagement continuum. So mental health engagement and recovery, we seek to work in the co-production space. So again, you can engage with people in a number of ways, in terms of informing people, to consult with people, to co-design, educate, involve, or lived experience led. But we strive to work in the space of co-production. So again, that's the equal relationship to either implement, you could deliver, evaluate support systems and services, where both consumers, carers, and professionals work in that equal relationship. So the next slide is looking at recovery education. So this objective is led by one of my colleagues, Fiona McKiernan. In terms of our plans for recovery education, we're working to develop a recovery education strategy, and currently a review is underway of recovery education across our mental health services. For recovery education, if you go on to our next slide, Stephen, please. We've delivered on the Sharing the Vision recommendation 29. So that's looking at further training and support should be put in place to embed recovery ethos among our working mental health professionals working in community mental health teams, as well as those delivering services elsewhere. So what has been produced is a recovery principles and practice workshop. So that's an introduction to our national framework for recovery and mental health. Again, that is a 4-hour workshop on how our staff can embed those recovery principles into our mental health services. So then just on to our next objective, and this is looking at how we can support and elevate the role of both family and peer support working in our mental health services. So again, back in 2022, mental health engagement and recovery secured a specific grade code for the peer support worker. We're working on a 5-year strategy to further develop the role of peer support. And 2 weeks ago, we hosted a conference. It was called the Whole Family Mental Health and Recovery Conference. And that was launched by Minister Butler, which was very well attended and further endorses the need to further support peer support working in our mental health services. On to our next slide then. So
Yeah,
our
next slide.
strategic objective 4 is sharing the vision. So again, this is looking at sharing the vision, our national mental health policy from and mental health engagement and recovery leads on 11 of those recommendations. Our office is a member of the HSE Implementation Group and also the National Implementation and Monitoring Committee called NIMIC. And again, as we're a member of both those work streams, I suppose that further endorses our work and the importance of mental health engagement and recovery and the voice of lived experience. To the right, you can see a number of the recommendations that we lead on. I'm not going to go into them in great detail, but I might just speak to some of them in just high level. So I suppose if we look at number 27, that's looking at how we can deliver on an individualized recovery care plan that is co-produced for service users. Number 29, again, that is looking at further training and support, which should be in place to further embed the recovery ethos. 71 is looking at IPS. So again, IPS is the individualized support service, and that is looking at further developing that. And also recommendation 72 is looking at our day services and how they can provide individualized supports for people with mental health difficulties that is consistent with New Directions policy. So finally, looking at our strategic objectives, this is the individual placement support. So individualized placement support is an evidence-based model in supporting people to gain meaningful employment where they choose to do so. So what that looks like in practical terms, each of our community mental health teams, we have 60 funded posts for employment specialists, and they will work with the individual and an employer in preparing for employment and supporting the person to seek employment and to maintain that employment also. We're hosting the first international learning set for IPS this year. That's being held in October. Again, that further supports the importance of IPS as a model, and also in how we can further develop this nationwide. We're also working on developing a national data set, and we're also developing a tender to undertake fidelity reviews. Again, fidelity reviews is looking essentially at an audit of IPS across the country to ensure we're adhering to the model of IPS. The next slide is just high level, I think, in terms of IPS. So again, just mentioning that that's evidence-based, effective method of supporting people with complex mental health difficulties to achieve sustainable, competitive employment where they choose to do so. IPS was mainstreamed in the HSE back in 2021, and we have 60 funded posts currently in the HSE. So appreciate I probably flew through some of those slides. So what I'd ask and encourage everyone to do is to look at our HSE website. So I'll share a list of resources with Ver and colleagues in mental health reform. I suppose just to look at our strategy. Some of the definitions in the strategy are really important, just to create a shared learning in terms of our understanding of what we mean by co-production, the recovery approach and lived experience. We also have some really good guidance and tools in terms of the engagement framework, in terms of our national recovery framework, and also the recovery education piece as well, where we partner with a number of recovery colleges across the country. So Ber, I might share with yourself after.
That would
So
be
thanks.
brilliant. Una, thank you so much. And I think it's so important for people to know about the Office of MHER and the work that you do, the vast work that you do. And just I'm delighted you shared the email address, because that was going to be my question of how can people get in touch with you. But just before we go to Barbara, a question has come in, Una, and if it's okay with you, we might just answer it here. It's just around the community education launch and the RAP programs or similar programs to empower individuals to stay well. Are there plans around that or funding available?
Sure. So I suppose that is the RAP is being I suppose developed, and we have a number of facilitators. We're actually undertaking a train the trainer currently as well, but I can link with that person after as well and circulate any information. Maybe the question is around RAP nationwide as well, so I can follow up with that person maybe individually, if that's okay.
Brilliant. That's perfect. Thank you so much, Una. And like that, you know, we do some work sometimes with Una's office, and hopefully next year we'll be doing more bits and pieces. So if you want to even get in touch with us, and then we can direct things on to Una as well. So I'm going to come over to Barbara next, who thankfully doesn't have slides. We're just going to see Barbara's lovely face. I don't know what's going on with the tech gremlins this morning. So it doesn't matter how much prep you do for these things, something can happen. So I'm going to turn my camera off again and hand over to Barbara, and then we'll be back for our wider panel discussion. Thanks, guys.
Thanks so much, Bear. So I am absolutely delighted and really excited to launch this guide. I will be honest and say that I actually let a little squeal out when I saw it in person, and both Stephen and Susanna on the call can attest to that, because honestly, it was a really beautiful process. So you've heard about co-production. This was done in the spirit of that. So when I started working with Mental Health Reform on this guide, it was looking at how do we encourage people to educate themselves on something that can be complex, bearing in mind the layers. So somebody may be struggling with their mental health, they may have physical things going on, and now they have to do this education piece as well. So the idea behind this guide was to really help people understand what their rights are, how to be responsible in that way to advocate for themselves and get the support that they need, but also in such a way that employers could look at this guide and say, well, actually, maybe we didn't understand it from this perspective. Maybe there's something more we need to do to help people understand, because as you heard Susanna say earlier on, some people don't know what their rights are. They don't know how to enact them. They don't know where to go. And most likely, a lot of people don't know how to start that conversation with their employer. So for me, this guide has been an absolute joy from the beginning, because we've been having these conversations about what does it look like for me if I am the person who is struggling, if I'm not managing my mental health, or if I am being treated in a less favorable way in my workplace. What are the things that I can do? So when we started this process, I had the joy of working with the Mental Health Reform Steering Committee, and we had an exploratory conversation around what was important to include in the guide. So by this stage, I had done a lot of research already and started looking at the UNCRPD. I had started looking at public sector duty, the employment law, all of these different things. And what became very clear to me is that there is a lot of documentation there for people to find. However, understanding it and also finding out how to action it was where the challenge lies. So even understanding what those things mean and why they're important to know about, I think, is what we need to help people with here. So from a point of view of what's in the guide, looking at the employment law, it's picked out the main things as they relate to mental health. So in the steering committee conversations, we were looking at why is it important that we have this conversation in the first place? So we started with the very basic piece around language. What is it that we mean when we use particular terminology? So is it mental health? Is it mental illness, mental health difficulties? Or under the UNCRPD, we start talking about psychosocial disabilities. So we started in that space again to help understand and to educate people around different ways to approach the same topic. We then started looking at the fact that the UNCRPD, so that's the United Nations Convention on the Rights of Persons with Disabilities, and the whole point of that is to protect people's rights, to make sure that there is fair treatment and inclusion happening. So it's about understanding where that lives, and if I'm having a negative experience, how do I engage with that and how can it support me? So that was one of the things then that we looked at. Okay, education. How do we include all of these pieces in an easy to understand way and in a practical way that not only do we understand the information, but that we start having those steps to work through what are the things that I need to do in order to enact my rights. So from a point of view of including the voices of lived experience, every single step through this guide was really important that it was understood from different aspects, whether it was from the employer aspect or from the employee aspect, and particularly from an employee when they are not well or when they are becoming unwell. So that was really important to include that. From a point of view then of the exploratory sessions, we also wanted to understand the impact. So when we were looking at educating around these different pieces, what impact did we want to have? And what key things would people take away from the information that they could find here? And how would they process it, or what else might they need to know? So the biggest thing that came across from all of the work that I did with the group was that they wanted to help others, that they wanted to improve how people engage with their own mental health, that they wanted employers to help sooner, to be more practical, and most importantly, to be kind. There has been a movement for people with disabilities, nothing about me without me. And this definitely is the case here, where we're looking at how do we have conversations in an appropriate way that's kind, that's supportive, that's practical, and is adhering to the law. So these are the things that we considered while we were putting this guide together. And really that clear information and the way that it was laid out was also very important. So looking then around discrimination, a lot of the time we hear people that they talk about discrimination, but maybe sometimes they don't understand very clearly what discrimination actually is from a technical point of view, and most importantly, the impact. So from then looking, how do we have this conversation from an employment perspective as an employee? What are the things that I need to be aware of? What are the things that I need to do if I think I am being discriminated against? How can I stand up for myself and counteract that? And most importantly, what are the things I can engage with in my workplace from an earlier and a more preventative place, so that maybe we can avoid that in the first instance? It may be lack of knowledge on the employer's perspective, that they don't know some of this best practice, or they're not fully aware of where they stand in relation to mental health and the employment law piece. So it's about a conversation happening. It was also important to look at the Employment Equality Act and how to engage in those. So it's one of the things that I love this guide, how it's laid out, that it's very, very simple in easy bullet points. And as Susanna mentioned earlier, there's also an easy read version. But understanding our rights and understanding what the law says can be tricky at the best of times. So this guide is really, really clear on that. From a point of view then of understanding what our rights are, there's this lovely checkbox. Sorry, I'm going the wrong way. There's a lovely checkbox here that has the different things. So for example, we are entitled to work in a place that has a safe environment that's free from hazards. We have the right to privacy and confidentiality. We have the right to reasonable workloads that don't negatively impact our mental health, for example. We have the right to fair treatment, and we have a right to readdress if we feel that there has been a violation of our rights there. So it's about understanding what those things are and the clear procedures that we might need to go through. And then there's a section more moving towards the back of the guide, looking at case studies. So when something is done really well, what does that look like? What is that interactive piece when we're doing something with somebody? We're supporting this person as they move through a difficult period in their life. They have these additional layers, and we're supporting them with those reasonable accommodations. Then there is a section that speaks about when reasonable accommodations may be put in place and good intentions are there. And yet, even with that good intention and the beginning of that practice, things fall through the cracks and then things are done to the person. So the end result is that the person feels othered, that they don't feel that they're getting the support, and it has a negative outcome. And then obviously the third example is when things are not done properly, when they're not done in a supportive or realistic way, when reasonable accommodations are not given. So in those instances, we're then looking at where can we go externally to get that support. So we've been trying to look at providing resources, helping people understand what it is that we need to do. The other thing that we also did was we looked at disclosure. So for some people, understanding what it is to have a conversation is one side and seeking that support and what the reasonable accommodations they need are. The other piece that people need to consider then is what does this disclosure look like for me? What am I going to tell? Who is going to know? What is the impact going to be? Is there a safety mechanism in place if I am discriminated against because I have shared this information? Is it actually necessary for me to disclose to receive the reasonable accommodation that I need? So these are conversations that we thought would be helpful for people looking at needing this kind of support. I think the biggest thing as we moved through this process was the feeling of wanting to help, of wanting to support each other, of wanting to make things better from negative experiences that we may have all faced. So for employers who may be on board now watching this or watching this back, I would really encourage you to look at this guide. It's not just for people who are in HR, it's for managers of all kinds to understand the support that can be given, the preventative things that we can do, and how we normalize those conversations so that if and when there's a problem, that people feel easier starting those conversations. And then from a point of view of somebody experiencing the mental health difficulty, I would encourage you to have a look at it, even if it's only the easy read version that you scan over, so that you understand if you ever do have a problem, where you can go to get support. And most importantly, that you do it sooner. Because quite often we look at what is really distressing us far too late. We have the impact of it, we have the experience of it, and quite often we get overwhelmed. So this guide is there to help people before it ever gets to that. And it really is to help people understand that there is help there. And sometimes it's just about being brave and starting that conversation. From a perspective of working with mental health reform and just moving away from the guide for a moment, it has been an absolute privilege for me to do this piece of work. It's something that I am really hopeful about, that we're going to have more conversations. But the fact that people with lived experience are being included at this level, that funding has been provided by IREC, that groups like Mental Health Reform are coming together and providing these resources is just phenomenal. When I look at my life, if I go back 20 years, I was that person who was excluded and I didn't have those kind of opportunities. So to now be informing conversations like this is absolutely phenomenal. And this is our opportunity to make a difference. So my ask to everybody who is watching this webinar is that you would download the guide, have a scan on it. At the very least, if you are like me and time poor from time to time, use the Easy Read guide, but share this guide, share it with your community, share it with people who are working, share it with employers. Let's get this information out there and let's help each other. Thank you so much for including me in the webinar today, and I really hope that this guide is going to be of value to you. Over to you, Bear.
Thanks so much, Barbara. I was trying to time when I should pop my head back on the screen, so we're still in perfect time. So I just wanted to say thanks again so much, and we're going to come on to our panel discussion now. But just on the point you made, Barbara, and it's come in as a question there around kind of accessible formats. I think it's really important for everyone to understand that, you know, as a movement and as a campaign, we all need to come together to make sure that funding is available for ISL and for a number of different types of accessible formats. And unfortunately, the reality is sometimes decisions have to be made about how we can make things most accessible to the vast number of people. So for example, with this, we have our ISL interpreters, we have captioning available, and the videos are being recorded and will be put up on online. And as you said, there's the easy to read version as well as the full version. So, it's not always possible within our funding constraints to make sure something is available in every single piece of accessible format, but it is something as a movement and as organizations we need to make sure we're talking about them. I just see someone else is looking for 2 hard copies, so that's great. So maybe if you can email info@ with your postal details. We do have, I'm looking at Susanna here, we do have a lovely box of them out there, and we want to make sure, as Barbara said, that they're getting into the hands of the people and the organizations that need them. So I'm going to ask Emma and Megan to turn their cameras on, please.